Hello everyone and welcome to my channel. Today we will be having a discussion on the topic of DPP-4 inhibitors. It is a group of drugs that is used for the treatment of type 2 diabetes mellitus. And it's a very important topic since a lot of question has been asked from this, and especially a question came from this topic in this year's INI CET July 2023 session only. So please stay tuned to the end of this video. It will be a very informative one. So let's begin. We will be covering the topic under the following headings. So let us take one heading at a time. So the first thing that we will be discussing today is what is DPP-4. Now DPP-4 basically stands for dipeptidyl peptidase 4. It is an enzyme and it is also known by the name of CD26. So this can also be a potential MCQ. What is the other name of DPP-4? It is CD26. It is a glycoprotein. It is a type 2 transmembrane glycoprotein with a molecular weight of 110 kilodaltons. This DPP-4, it is expressed as an extracellular enzyme on the vascular endothelial T cells as well as on the surface of the T lymphocytes. Now on the surface of the T lymphocytes, this is known as CD26. So another potential MCQ can be that where do we find CD26? We find CD26 on the surface of the T lymphocytes. And even this DPP-4, it is also available in a freely circulating form. In a study that was conducted by Rohmann et al. In 2021, it was shown that DPP-4 concentration is higher in individuals with obesity. And we all know that obesity is a risk factor for the development of type 2 diabetes mellitus. Now the DPP-4 inhibitors are the drug that we use for the treatment of type 2 diabetes mellitus. Now the drugs that are used as DPP-4 are sitagliptin, vildagliptin, saxagliptin, tenagliptin, alogliptin and linagliptin. So this is basically the class of gliptins. So the DPP-4 are gliptins and they are used for the treatment of type 2 diabetes mellitus. So let us now understand what is the role of DPP-4 in diabetes. Now the enzyme DPP-4 or dipeptidyl peptidase 4, it cleaves and inactivates peptides. Since it is a peptidase, so it will cleave and inactivate peptides and inactivate peptides such as glucagon-like peptide 1 or GLP-1 and glucose-dependent insulinotropic polypeptide or GIP. Now both GLP-1 and GIP together, they are known as the incretins. And they ultimately help in the synthesis of insulin. So if they are degraded, then the synthesis of insulin is actually hampered and the patient develops type 2 diabetes mellitus. So DPP-4 inhibitors, they have been used to treat type 2 diabetes mellitus. And two very important point, it can be potential MCQs as well. GLP-1, it is secreted from the K cells of the duodenum, whereas GIP, it is secreted from the L cells of the distal intestine. So let us see in a little bit more detail what actually happens. Suppose we ingest a meal that is rich in glucose. Now this glucose, it is going to act as a simulator for the synthesis of incretins. Now these incretins will be synthesized from the small intestine. The GLP, as we have already discussed, it will be released from the K cells and the GIP from the L cells. Now these incretins, they are going to activate the beta cell of the pancreas and inhibit the alpha cells. Now due to the activation of the beta cells, the stimulation of the beta cells, there will be increased insulin secretion, and due to the inhibition of the alpha cells, there will be decreased glucagon. Now the increased insulin and decreased glucagon together, the final result will be there will be decrease in the blood glucose level. Now these incretins GLP-1 and GIP, they are inhibited by the enzyme dipeptidyl phosphatase 4 or DPP4, and the incretins are converted into inactive peptides. Now this DPP4 is inhibited by the group of drugs that we are discussing today, that is the gliptins. So if the DPP4 is inhibited, the level of incretins will be more because they can't be degraded now. So these more level of incretins is going to stimulate the beta cell and the alpha cells, and ultimately there will be increased insulin and decreased glucagon, and finally the end result will be decrease in the blood glucose. So that is how the gliptins act on a patient of type 2 diabetes mellitus. So as I have already discussed that gliptins are the inhibitors of DPP4. Now the competitive inhibitors of DPP4 are allogliptin, linagliptin and sitagliptin. This is also a potential MCQ question. And the drugs that bind the enzyme covalently are vildagliptin and saxagliptin. Let us see the pharmacological effects of gliptins. These gliptins, they lower the measurable activity of DPP4 since they are DPP4 inhibitors. So they will lower the activity of DPP4 by 95% for 12 hours. And since the level of DPP4 has been reduced, the level of GIP and GLP-1, that is the incretins, will be increased. These increase will be greater than 2 times. Naturally, due to the increased GIP and the GLP-1, there will be increased insulin secretion and reduced glucagon levels. So the gliptins, they improve both the fasting as well as the postprandial hyperglycemia. When they are used as a monotherapy or when they are used alone, they reduce the HbA1c levels, and this reduction occurs by an average of 0.4 to 0.8%. Even they are also effective for glucose control when they are added with some other oral hypoglycemic agents such as metformin, thiazolidinedione such as rosiglitazone, pioglitazone, sulfonyl urea such as glipizide, glicazide. The effect of DPP4 inhibitors in combination, it is found to be additive. So what is the end result that we are getting with gliptins? We are getting, it is decreasing the HbA1c level. It is increasing the insulin levels. It is decreasing the glucagon levels. And how is it occurring? It is increasing the incretins, that is both the GLP-1 as well as the GIP. Some salient pharmacokinetics of this drug. Now these drugs are given orally. They are absorbed from the small intestine. Now this is also another potential MCQ. The gliptins are absorbed from the small intestine. Now the drugs are circulating in a primarily in an unbound form, and they are excreted largely unchanged in the urine, most of the drugs. So which drugs are largely excreted unchanged in the urine? You have got alogliptin, saxagliptin, sitagliptin and vildagliptin. So if they're increased, if they're excreted from the urine, that means in a patient of renal disease, the dose of alogliptin, saxagliptin, sitagliptin and vildagliptin, they need to be reduced. Now the other drug that we have, that is linagliptin. The linagliptin, it is binding to the plasma proteins. So rest 4 drugs were mainly in the unbound form. Linagliptin binds to the plasma proteins, another potential MCQ. And it is cleared by the hepatobiliary system. Hence, for a patient of renal failure, the dose of linagliptin need not be reduced. Now saxagliptin also has a few important points. Most of it is actually found in is excreted unchanged in the urine. Some of it is metabolized by the hepatic macrosomal enzymes. So the dose should be lowered to 2.5 mg daily. It is given in usually given in a dose of 5 mg daily. The dose needs to be reduced from 5 mg daily to 2.5 mg daily when they are given with strong CYP3A4 inhibitors, or rather inhibitors of the microsomal. Now some of the examples of CYP3A4 inhibitors are ketoconazole, atazanavir, clarithromycin, indinavir, itraconazole, nefazodone, nelfinavir, ritonavir, saquinavir and telithromycin. So along with all these drugs, the dose of saxagliptin needs to be reduced to 2.5 mg daily. Now one recall question that was asked in INI CET July 2023 session, it was about a lady who was suffering from diabetes and she was prescribed some oral drug. Now the first catchphrase here is the lady was given an oral drug. Now these drugs reduce the HbA1c level, it increased the GIP as well as the GLP-1 levels, and it decreased the glucagon levels. So an oral drug which reduces the HbA1c level, increases the incretins and decreases the glucagon level is gliptins. In this case it is saxagliptin. Now mostly gliptins are very safe drugs, but one of the adverse effect against which there is a FDA warning, and that adverse effect is severe joint pain. That's it for today guys. If you like the video, then give it a thumbs up and also share it. Do subscribe to our channel and don't forget to press the bell icon so that you don't miss out on any upcoming videos. Also let us know down in the comments below what are the topic you would like us to discuss. Until next time, goodbye and take care.